My blood sugars were, I have a continuous glucose monitor, so I can see my blood sugars in real time. And originally, my blood, or before I started the program, my blood sugars were running, as high as 200, 237, 240. Especially when I would eat, they would get way up. So, uh, since I started the program, my average blood sugar has gone down to like 119, 117. And this is 6 weeks into the program. So I think it's absolutely amazing to see that much progress. Before the program, my fasting blood sugars were around, uh, like 125, 135. And now my fasting blood sugars are down in the 90s, 99, 98, 97, things like that. So it has been amazing to me to see the changes.
That's
And I
awesome.
feel better.
Yeah,
I feel so much better. I have so much energy and motivation, and it just feels better. And losing weight is a bonus. I'm not that concerned about being overweight. I am to some degree, but that's just a bonus to me to see the weight fall off. I would say to have hope because I'm a registered nurse and I was kind of skeptical at first because I was thinking, this just kind of goes against all my old school training on diabetes. And I've had issues with my registered dietitian and my endocrinologist that wanted to put me on Monjero. And I had already had issues with Rybelsus giving me delayed gastric emptying, and I did not want to go on another GLP-1 agonist and make my stomach get paralyzed. So I was really looking for something that would be effective and help me get my diabetes under control. My hemoglobin A1C was 8.8, and I have gotten it down to 7 with the Mediterranean diet. But that still wasn't good enough. It was still out of control. So this, I'm excited in 2 weeks. Well, about a week, I have another hemoglobin A1C, and I'm excited to see what that looks like.
okay.
It excites me to no end to think that there's things that we could do for diabetes that don't necessarily mean you have to be on injections for the rest of your life or dialysis machine or, things like that. I still take medications. I'm still on metformin. I'm still on Jardiance, but I have a feeling that the Jardiance is at least going to be discontinued pretty soon.